make my life a lot easier. You're doing perfect right now. Are you feeling anything weird? Good. You know, you will feel a little cold water sensation here. Right about now. Beautiful. If you watch that later, you'll see your pupil dilate perfectly. Are you planning on watching the video later, Rick?
No.
No, not so much. Not your thing.
No.
Okay, never mind then. Never mind then. Well, you're going to have somebody you want, like, you know, it's going to be your wife, or there's always somebody in the family who likes to watch the surgery channel. Who do you think that person would be?
No one.
No one? All right. All right. Okay. Everything's looking really good here. Do you want any kind of narration while we're doing this? You probably don't. You probably don't want to know what I'm doing. All right. I did LASIK on a friend a few years ago, and I was talking her through it like I always do, and then she goes, "Stop! Just stop! I don't want to know what you're doing. Stop telling me what you're doing." It's like, oh, sorry. All right. Thanks.
Out there, I was just afraid of getting scratched.
A scratch on your eye? You mean that I would do or that you would do?
Me, because I'm working in an orchard.
Oh, really? What kind of orchard?
Over trees.
There's a lot of those around here, huh? What do you do there? Just maintain the whole place?
My dad maintains, I pick them up. I'll pick them up.
Huh. Is there a lot of automation that goes on there, or is it still largely done by hand?
There is, but they stopped doing our orchard 2 years.
Really? How come?
The man that has the monopoly on genes said that our trees are dying and too old. It wasn't worth his trouble. But I think part of that, he went into contract, which takes about 30% of the crop.
And you,
And my dad won't do it.
huh. That's interesting. So it makes more sense for you to harvest them yourself by hand.
Yes, it's a lot longer.
Yeah. I guess it depends how many you have. You know, if it's so many that you couldn't harvest them,
2 acres.
and you have the margin, then, well, may as well split the profits. But if you can do it, 2 acres, can you do it all yourself?
My dad, myself, and then sometimes my sisters.
Yeah. Oh, really? You could probably hire some labor if you wanted to. How old are you?
I'm 70 and he's 97.
He's 97? No kidding. And he still is working in the orchard?
Yes,
Every
every day.
day? That is amazing. What's his secret?
I don't know, he's got an older brother that's 98.
No kidding. My grandpa just passed at 91. I've got a fair number of patients in their 90s, but it is really rare to see someone in their late 90s, period, let alone someone in their late 90s who is still physically active. I mean, that is really astonishing. And to have 2 in one family. We need to have the scientists study your guy's DNA. Put it in a bottle. Maybe it's those hazelnuts. Sweeper, please. Thanks. Great. What's the axis here?
Axis at
101, thank you.
Alzheimer's runs in the family.
Really?
all three of their sisters died from complications of it. And
Huh.
the younger brother just died in March from, I think most of his complications were from it too.
From Alzheimer's?
Yeah.
Well, yeah, I mean, you can't take care of yourself anymore. If the mind is gone, then the body just kind of wilts, I guess.
I remember one of the doctors I worked for, he said you get to meet new and interesting people every day.
Yeah. Reminds me of the Notebook by Nicholas Sparks.
Right.
Can I have the axis marker? You have it, good. Now, will you look straight ahead, directly at that bright white light that is a little to the left of the other two lights? Right? It's inside the microscope that's directly above you. Yeah, I think you're getting there. Call the axis. If we're going for 110, it's going to be right there. What's that?
Said this just get glued on.
Glued on? No, we do use glue in some forms of eye surgery, but that's uncommon. And in this case, there's no need for glue because we're pretty tricky. We put the new lens in the pocket that the old lens used to live. So we just evict what was there and get a fresh one. Can I see that axis marker again?
Mm-hmm.
Just lost track of where my axis was. 110. Yeah, right about there will be perfect.
You did your Voxidex first, right?
Yeah, I do. Okay, look directly at the bright white light, a little to the left of the other two. Good. Okay, keep looking at it. See it? Look right at it. What we're doing here is trying to get the lens centered. You looking right at it?
Yes.
Perfect. Okay, I like that. Okay, we're going to check the ports and make sure they're all sealed up and they look really nice. Almost done here. We're going to give you a little bit of an antibiotic. You won't feel anything there. And finally, a little anti-inflammatory treatment, which might sting just a smidge. Whatever you're feeling right now is 100% normal. Okay, we're all finished. Any questions? Comments? Yeah, you were a little more aware this time, weren't you?